Hi there, viewers! When you're feeling minor discomfort, it's usually a sign of, well, not much. Maybe you had a heavy meal, a stressful day, a hard workout, and by the next day you feel fine again. But a handful of trivial-sounding symptoms can sometimes be a red flag for something more serious. Since it's often hard to distinguish between the no big deal and the dire, most of us err on the side of ignoring the problem and hoping it goes away. In fact, the average woman waits about 13 weeks before visiting a doctor after experiencing symptoms of a serious disease. But sometimes these symptoms can be your body's way of telling you there's something else going on. If you listen up and seek treatment quickly, you can prevent an emergency or an irreversible diagnosis. In today's video, we'll tell you what these symptoms are and how you can identify them. From losing too much weight to feeling tired all the time and many more. Stay tuned to find out. Number 1. There are blood clots in your period. Everyone's period is different. It can be lighter, darker, heavier, and so on. And it's absolutely okay if you notice a clot or two every once in a while. However, if your blood turns dark and the clots are consistent and huge in size, this could be a sign you have uterine fibroids. These non-cancerous growths in your uterus can cause abnormal bleeding and be a sign of bladder issues. Number 2. Your belly is bloated. For some women, bloating is a normal part of their monthly period. But if you aren't prone to bloating and you've been experiencing it for more than 2 weeks, this may be the first sign that there's something out of balance with your body. In case of endometriosis, your belly can simply swell on any given day and get worse as the day goes on. Endobelly is usually unpredictable, and bloating can stay with you for days and even weeks, or disappear in a couple of hours. Besides that, constant bloating could be a sign of breast or ovarian cancer. Number 3. You have a cough that just won't quit. A nagging cough can linger from a past cold or flu for a good few days, and that's normal. However, if you have a persistent cough that didn't come from a prior illness and that's been sticking around for weeks, it's cause for concern. If you're a smoker, you may have a smoker's cough that could be cured by quitting this unhealthy habit. If not, your cough could be a symptom of something serious, like lung cancer, a lung infection, or pertussis, also known as whooping cough. If your cough is accompanied by a fever, it could be a lung infection that needs antibiotics. Whooping cough and lung cancer also need to be treated immediately, so visit a doctor if your cough just won't quit. Number 4. You get frequent heartburn. Heartburn is an uncomfortable burning sensation in the throat or chest from stomach acid. It can be caused by eating decadent or spicy foods or consuming alcohol. Obese or sedentary people are more inclined to suffer from heartburn frequently, as well as smokers. If you find yourself popping heartburn pills more than a few times a week, you're on track for some nasty side effects. Remedying your own frequent heartburn or just living with the condition can eventually cause inflammation in the esophagus, which can lead to ulcers and serious bleeding. You may also be putting yourself at a greater risk for esophageal cancer if you ignore your frequent heartburn. Number 5. Sleeplessness or excessive sleep. As you age, the amount of sleep your body requires is known to decrease, and occasional restless nights are a given for most women. But if you have been unable to sleep night after night, there could be a problem. Consult your physician for probable underlying diseases. Depression, hyperthyroidism, GERD, sinusitis, and arthritis are some of the ailments which are known to cause sleeplessness. Number 6. Changes in your breasts. Notice we didn't specify lumps. While most women think a bump is the only cause for concern, any changes in your breasts can be a sign of cancer. Bloody discharges from your nipples and persistent rashes can also signal breast cancer. Also, keep in mind, not all tumors are cancerous. You'll need to get a biopsy to know for sure. Try not to go into immediate panic if you do feel something. Many women feel tenderness and a general lumpiness while menstruating. If you continue to notice something that seems unusually long after your period ends, schedule an appointment to see your doctor. Number 7. Unexplained weight gain. Few things can be as frustrating as unexplicable weight gain, especially if you've taken measures like diet and exercise to lose or maintain that number of scale. Vanity and discomfort aside, an unexpected rise in your weight, unrelated to the variations that occur before your period or with new medication, could be an indication that it's due time to schedule an appointment with your doctor. Why? Medical conditions such as hypothyroidism and Cushing's syndrome may impact your ability to slide effortlessly into your clothes, while fluid retention, known as edema, may point to kidney disease or cardiac problems. Number 8. Frequent headaches. Hormonal changes and raising hormonal teenagers can spur an achy head, and while this shouldn't be ignored either, a sudden, acute headache may be a sign of a brain aneurysm. Sounds petrifying and impossible? Think again. More common in women than in men, up to 5% of people who experience a brain aneurysm don't even notice this arterial bulge or ballooning in the skull. Most brain aneurysms don't rupture, create health problems, or cause symptoms. Such aneurysms are often only discovered during tests for other conditions. But when a rupture is accompanied by a severe headache, as well as confusion, blurred vision, and nausea, your health may be at immediate risk, with potential complications ranging from brain damage to rebleeding. Prompt medical attention in these cases is crucial. Number 9. You are constantly fatigued and tired. Despite it being the 21st century, women still carry the double burden of home and office, and so being tired is second nature to them. The 21st century fad is also a very unhealthy competition between who is the most sleep-deprived and tired. Today's lifestyle means it's very difficult to differentiate between occasional fatigue and constant fatigue. One trick is to look at fatigue levels after getting a good night's rest. If you feel refreshed after 8 hours of sleep, it may not be something to worry about. But if you feel exhausted even after a good night's sleep, it may indicate something serious. Constant fatigue could be indicative of depression, liver failure, cardiovascular disease, sleep apnea, cancer, kidney failure, diabetes, anemia, even chronic fatigue syndrome. If fatigue is a regular part of your life, it's advised that you consult a doctor to plan for all necessary diagnostic tests. Number 10. Chest pains. Women tend to write off chest pains as heartburn, in worst cases as indigestion. However, chest pains shouldn't be ignored under any circumstances. If chest pains are accompanied by shortness of breath, pain in the left arm and shoulder, and hot flashes, it could be an indicator of cardiac diseases. Cardiac blockages in women are detected after their menopause, as the hormone estrogen produced by the uterus contains lipoprotein, a good form of cholesterol which aids with the movement of the heart. The uterus stops producing estrogen after menopause, putting women at risk for cardiac diseases. Number 11. Constant pelvic pain. Pelvic pain is different from your usual cramps. It can be sharp, one-sided, and may come suddenly. If it's on the right side, it can point to appendicitis, right ovarian cyst, rupture, or kidney stones. If it's on the left side, it may indicate left ovarian cyst or rupture, diverticulitis, or left kidney stones. If you have severe lasting pain accompanied by bloating, you can suspect ovarian or pancreatic cancer. Number 12. You have a swollen neck. Does your neck feel a little swollen? Don't just write it off, especially if it's not due to something like a cold, as it could be some serious health problems. The front of your neck is full of lymph nodes and your thyroid gland. Swelling there can be a sign of infection, lymphoma, swelling of the thyroid, or masses within the thyroid gland. Lymph node swelling is common with a cold or sore throat, but if it persists or occurs when you're not sick, have it checked out by your doctor. Number 13. There are pimples on your chin. About 2 weeks before menstruation, your body increases estrogen and progesterone. Because of this change in hormone levels, you may experience an acne breakout on your chin that should go away after some time. However, if you consistently have pimples on your jaw or chin, it might mean that your hormones are out of whack and you need to see a doctor before it's too late. Number 14. Frequent skin breakouts. Acne breakouts aren't just annoying, they can also be a symptom of other imbalances in your body. If you recently changed facial cleansing products, or it's your time of the month, a few zits can be easily explained. However, if you've never really had pimples before and you're dealing with some harsh breakouts, you should take it seriously. Acne is a sign that your body is producing too much oil or that it's come in contact with bacteria. Consistent acne that's unresponsive to treatments can occur if your body is dealing with hormonal imbalances. It can also occur when you begin to go through menopause. Consult a doctor to help better understand the root cause of this problem. Have you ever experienced any of these symptoms? Did any of them surprise you? Let us know in the comment section below. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.